Are rhinovirus and cold symptoms related? Imagine catching a cold and wondering what's really behind those sneezing fits and runny nose. Well, a big part of that story involves a tiny virus called rhinovirus. Rhinovirus is actually one of the main culprits behind the common cold. When you get infected with rhinovirus, the symptoms you experience are very similar to what we call cold symptoms. These include a runny or stuffy nose, sneezing, sore throat, coughing, a mild headache, and sometimes a low-grade fever. Usually, these symptoms start showing up within 2 to 3 days after you come into contact with the virus. They tend to last about a week, but some signs like cough can stick around a little longer. Rhinovirus spreads very easily. It travels through tiny droplets when someone sneezes or coughs, and it can also spread by touching surfaces contaminated with the virus. Because it is so common, especially during cold and flu seasons, many people get infected multiple times a year. The good news is that most rhinovirus infections are mild and resolve on their own. There is no specific cure for rhinovirus, so treatment mainly focuses on relieving symptoms. Rest, staying hydrated, and using over-the-counter remedies like decongestants or pain relievers can help you feel better. Antibiotics don't work against viruses like rhinovirus unless a secondary bacterial infection develops, which is less common. Understanding that rhinovirus causes the classic cold symptoms helps clarify why so many people experience similar illnesses during certain times of the year. When you have a runny nose, sore throat, and cough, it's often rhinovirus at work. Recognizing this connection is useful, especially when trying to differentiate between other respiratory illnesses like influenza, which tends to cause more severe symptoms and can lead to complications. Knowing the role of rhinovirus also emphasizes the importance of good hygiene practices, such as washing hands and avoiding close contact with infected individuals, to prevent catching or spreading the cold. In summary, rhinovirus and cold symptoms are directly related because rhinovirus is a primary cause of the common cold. The symptoms caused by rhinovirus infection are the typical signs of a cold, and understanding this helps in managing expectations and treatment. If you're feeling under the weather, it's always best to consult a healthcare professional for personalized advice, especially if symptoms worsen or last longer than a week. Remember, staying informed and practicing good hygiene are your best tools in avoiding and managing colds caused by rhinovirus.